And I'm from the Devoted Health Sales Team. You're in the right place to learn how to find the right Medicare plan for you. Today, we're going to talk about how to get the Medicare benefits you need, how Devoted Health does Medicare Advantage, and tips for finding a plan that works best for you. If you have questions at any time as I'm talking, just call the number on the screen. Okay, let's jump in. With Medicare, you basically have two options. Whether you have Medicare now or you're totally new to it, you'll likely choose between Original Medicare and Medicare Advantage. The option you pick has a big impact on the benefits you get and the cost you pay. So it's important to understand the difference. You get Original Medicare from the federal government. It includes Medicare Parts A and B coverage for your medical care and hospital visits. But Original Medicare doesn't cover everything. It only pays 80% of your healthcare costs. You may need extra coverage to pay the other 20%. For example, Medicare does not cover prescription drugs. That means you have to purchase a standalone drug plan to get your Medicare Part D coverage. And you'll have out-of-pocket costs for healthy must-haves like your dental and hearing and eye exams. Your costs can add up fast. Medicare Advantage plans are usually run by private insurance companies like Devoted Health. Every Medicare Advantage plan covers all the same services as Original Medicare. It's required by law. The big difference between the Medicare Advantage and Original Medicare is that many Medicare Advantage plans include lots of extras like dental, vision, hearing, rides to the doctor, and more. That's where the real advantage to Medicare Advantage shines through. And it's why we at Devoted Health wanted to design our own Medicare Advantage plans. This side-by-side comparison shows your Medicare options and how Devoted Health plans deliver all the benefits you may want and need. Next, we'll take a closer look at our plans and show you how to choose the right plan for you. At Devoted Health, we're trying to do Medicare Advantage plans differently. We're a newer Medicare company. Our founders started the company because they wanted to make healthcare easier, more affordable, and more about you. Here's what you can expect from any Devoted Health plan. Number one, benefits, lots of benefits. We want you to be able to use our plan to get head-to-toe coverage. So most of our plans include things like dental, vision, hearing exams, money for wellness and fitness. Number two, really good customer service. What good is your health plan if it's hard to use, or if you can't call them with a question and get an answer fast? Our plans are supported by a team of customer service superstars. We call them guides. And number three, a network of trusted doctors and hospitals. We make sure we only work with the doctors and hospitals we want our own family members to see. It's how we can feel confident you get the highest quality of care you can. So let's take a closer look at those benefits. With Devoted Health, you get head-to-toe coverage, not just Medicare benefits, but what you need to feel your best. If you pay out of pocket for some of those now, you won't be with us. Here, you'll see some of the benefits you'll get with most Devoted Health plans. $0 copay for PCP visits and low copays to see specialists. A long list of prescription drugs starting at $0. And $0 copay for dental services like your exams and cleanings, free eye exams and money to spend on eyewear, contacts, free rides to the doctor, free hearing exams, plus a low copay for hearing aids, plus money to spend each month on over-the-counter items like vitamins, a free gym membership, good at thousands of locations, and so much more. Our plans also have a maximum out-of-pocket limit. That means there's a limit to what you will spend on medical costs each year. A maximum out-of-pocket will help you budget your money better, and it gives you peace of mind. If something unexpected happens, that maximum out-of-pocket will help protect your savings. You don't get that on Original Medicare. It's pretty impressive when you compare our plans to Original Medicare, other Medicare Advantage plans. All these extra benefits add up to more coverage and more savings. And I mentioned this earlier, but all our plans come with the support of our customer service superstars. We call them guides. When you call Devoted Health, you're not going to be put on hold waiting for a real person to pick up. Our guides answer 78% of our calls within 30 seconds or less. And they're based right here in the United States. They can answer questions about your plan, find in-network doctors, answer billing questions, and a whole lot more. And most importantly, our guides stay on the case until you have the answer you need. We're also proud to say that we solve 80% of our member issues that same day. There's nothing too big or too small they can't help with. Again, if you have any questions, or if you want to see what plans are in your area, call us at the number on your screen. So how do you find the right plan for you? I have a few tips that can help. Get the plan you need by looking closely at these three things: benefits you want and that you're going to use, in-network doctors and hospitals that you trust, the drug coverage you need. And as you review the plan, look at the benefits. Does the plan have a low or no monthly premium? Do you need to see specialists? How often? What's your copay? How often do you get tests like lab work or x-rays done? Are they covered? Do you need or are you planning any surgeries? What about other benefits? Does the plan have a copay for PCP visits? Is dental included? Hearing and vision? Free rides? Are there programs to help you stay healthy? Do you get money toward glasses and contacts? And monthly over-the-counter allowances to help you buy items that you need? Be sure the plan has a network of doctors you can trust. Do you have a primary care provider, a PCP? Is your PCP and your preferred specialist in the plan's network? Is your preferred local hospital included? Is it easy to see your doctor when you need care? Visit our online provider directory at www.devoted.com/search-providers to see if your doctors are in network. The URL is at the bottom of the screen. Are your prescriptions covered? Does your plan include drug coverage? If you take drugs regularly, are they covered? If there's a deductible for Part D, you'll need to pay it before the plan starts paying their share. Do you have coverage through the coverage gap? Are you looking for a lower drug copay? Plans have different drug costs and coverage and may not cover the same drugs. Call the plan to see if they cover your drugs and what they'll cost you, or visit the plan's website to see their list of covered drugs. In addition to looking at the benefits and network, it's good to do a health evaluation. Look at your health status and make a checklist. Add up your potential health costs, doctor visits, prescriptions, health screenings. Make sure you include costs for all your extras like glasses, gym memberships, hearing aids, dental, and more. Then take a best guess about your healthcare needs for the coming year. Do you need frequent health screenings due to family history? How often will you need to see a doctor? Will you need care by a specialist? What about any major or minor surgeries? Is your eyesight or hearing changing? Has your doctor suggested you join a gym or increase your activity? Will you need comprehensive dental care? Write down what you need and want in a plan. In-network doctors, preferred local hospital, medications, dental care, hearing aids, glasses or contacts, gym membership, medical alert device. When you step back and look at your answers, you should have a sense of what type of benefits and savings are right for you. If you have questions now, just give us a call. Okay, now there's one final thing that you'll want to keep track of. That's your sign-up date. You can't sign up for a Medicare plan at any time. But right now, you're in luck. Medicare's annual enrollment period begins October 15th and it ends on December 7th. You have until then to sign up for a plan. It's your chance to switch Medicare plans if you don't like your current plan, want more benefits, or want to save more money on health care. New plans are announced on October 1st, but you'll need to wait until October 15th to sign up for one. That gives you time to review their benefits. Remember, the deadline to sign up is December 7th. Signing up for a plan outside the annual enrollment period during the rest of the year depends on a few things. Turning 65, then you have the 3 months before your birth month, and 3 months after your birth month to sign up. You can also sign up if you're eligible for a special enrollment period. That happens if you move, choose a 5-star rated plan, or in certain other circumstances. We're committed to helping you find the right plan. Your health and needs change, so we encourage doing a yearly plan checkup. Our agents will help you make an informed choice to choose a plan based on your needs and budget. Check to be sure your doctors in our network confirm that your drugs are covered and help you apply for Medicare assistance for lower cost. Call us to schedule a no obligation consult with one of our agents. There's no obligation to sign up for a plan. We can answer any questions, give you more details on our plan, and help figure out which plan may be right for you. We can also send you a free Medicare comparison guide. We're here to help, so call us today or visit us online at www.devoted.com. Thank you for joining us today. I hope you found this information helpful. Thank you all again. Have a great day.